بسم الله وحده والصلاة والسلام على من لا نبي بعده. We begin in the name of Allah. We're talking today to our dear respected sisters and elderly women. Today we will talk about the three groups of women. Who are they? The topic that we picked is menstruation. The woman of Adam alayhi salam, the daughters of Adam, Banatu Hawa, they are to bleed. It is the thing that when they came on earth they were cursed with. Or is it a blessing? Women are grouped into three categories as far as menstruation is concerned. Number one, first-time beginners. Number two, regular menstruating women. And thirdly, pregnant women. The maximum period time is for the woman who is the beginner. Al-Mubtadi'ah, they say in the Arabs. Al-Mubtadi'ah damuha 15 يوما, 15 days. After 15 days, she adds 3 more days, and after that, 3 more days, and she should not exceed 15 days. If she reaches 15 days, after that, 15 days is considered to be dam al-istihada, or the bleeding of sickness. So, 3 categories. So, number 1 is the beginner that we just talked about, and the other one they're called the mu'tada, the one who is her blood comes all the time. In other words, that is the category of the woman that once she becomes a beginner, she will next go into the next category, which is al-mu'tada, the regular bleeding woman. And mu'tad means that she has a time, idda, that she always will have the blood coming to her at that time. Sometimes she'll get it for 8 days, one of some women. Some get it for 10 days. And some get it up to 15 days. So, that kind of woman, what does she do? Once she gets her blood, she should, if the blood comes and it continues, she should wait 3 days and add another 3 days and not exceed 15 days. After she exceeds 15 days, then she should go to the doctor, because that is not normal blood. It's called the blood of istihada, the blood of sickness. And that is the second category. Number 2. The third category is the woman who is pregnant. Al-Hamila. Now, the pregnant woman, she might get her blood up to after 3 months, after 15 days. For a pregnant woman, the maximum is 15 days when she is over 3 months pregnant. So after she's 3 months pregnant, it's gonna be 15 days that she will have the period for. And after 6 months of pregnancy, it becomes 20 days. The blood will come and will be like a 20 days. And if the bleeding stops in intervals, she puts the intervals together until she completes her normal period. But what we know normally is that if a woman is getting blood while she's pregnant, usually women, when they're pregnant, they don't get any blood. So if a woman gets blood when she is pregnant, that means that it's damul istihada, that blood of sickness. Now, things that the woman who is bleeding cannot do. It is not permissible for a menstruating woman to perform salat, to fast, or do tawaf. She cannot enter the mosque nor read the Quran. She must, however, make up for the fasting, but not for the salat. Her recitation of the Quran is permissible, for just if she's teaching or if she's a student. And if she's reading the Quran, her recitation of the Quran is permissible, that she can, like from her mouth, and she teaches it. As long as she's a teacher, she can teach it. But if she's not a teacher, then she shouldn't touch the Quran, but she can read it from heart. And her husband, however, is not allowed to touch her private part or anything between her navel, her stomach, her belly button, and her knees until she completes her blood, until her iddah finishes, and he cannot touch her until she makes ghusl. Once she makes ghusl, he can, touch her and do whatever he wants, business, the halal that Allah made halal for her between husband and wife. And she should make up the fast, but she doesn't have to make up the prayer. Okay? And now we talk about the last thing. It's called postpartum bleeding. Postpartum bleeding is the same as menstruation as far as the things it prohibits are concerned. Its maximum duration is 60 days. It's 60 days, which is the bleeding that the woman gets once she has a baby, which is 3 months. If, however, the bleeding happens to stop even 1 day after delivery, it stops, she should perform ghusl and observe her salat. But usually it lasts up to 60 days, and then after that she makes ghusl and she prays. And if she was during pregnancy, she couldn't fast, she makes up the fast, or she can give sadaqah, and it's best that she gives sadaqah and she makes it up. But if she can't make it up, it's very hard on her, then she just can give sadaqah. In case the bleeding starts again and 15 days or more have passed, then the second is the menstruating period. So if she has blood, okay, and when she has blood in the nifas, nifas is the bleeding after pregnancy. If the bleeding stops before 15 days, okay, then in case the bleeding starts again and 15 or more days have passed, if less than 15 days is considered to be the first menaces of the nifas. But if it continues more than 15 days, then it's considered the second menstrual period, blood. If it is less than 15 days, then it must be counted with the first until the completion of postpartum bleeding is completed. And once the woman is clean of hayd, nifas, and she identifies from hayd and nifas, she takes a shower and she can pray, and she can do her regular duties with her husband in terms of taking care of family and logical business. And her if she's a teacher, as we said, she can teach as long as she does not touch the mushaf. But she can touch things like digital, like the computer and stuff, if the Quran is in there, or she can read the Quran from heart. هذا وقل ما تسمعون والله تعالى أعلم.